Good afternoon, everyone. It's a pleasure to be here today with you, and thanks to the ECHAlliance for organizing this again and for having me. I'm going to talk about the digital health strategy for Catalonia. It's a project that we've been running since year 2017. And in order to do such, I will start first with a bit of history in Catalonia about how we built our platform, how we managed to have a mature ecosystem of health information technologies, and well, which are our thoughts towards the future. And this will also include which are the investments that we are making for this to happen and for this to become true, and not just have a strategy with no money behind. And well, the joke of the backpack full of money. So Catalonia, just for the ones that you don't know, it's a very fragmented ecosystem of service provider organizations. We have as much as 160 different healthcare provider organizations, which within the 80s and the 90s were able to do, I would say, the first wave, what I call the first wave of digitalization, which means the translation of these paper processes that we had everywhere to a model which was digital. And we started with administrative systems, managing patient-related information and also mainly billing. But then we started to move towards these initial EMRs in which we started to process clinical information. At the very beginning, it was documentation systems, same as everywhere else. And then step by step, we started moving towards more, I would say, structured information within the systems. I would say that one key difference of the Catalonian ecosystem versus the other Spanish regions is precisely this fragmentation. As opposite to Catalonia, most of the other Spanish regions have just a unique system for EMR or EHR, while here in Catalonia we have many different systems, as much as 29 different systems in our hospitals, that we link them throughout interoperability. And we successfully achieved doing such back in year 2006 with this project named the Shared Electronic Health Record of Catalonia. It's possibly one of the eldest experiences in health information exchange, I would say worldwide, and also very big in terms of the amount of information that we are managing in our ecosystem, which is connecting all of our public service provider organizations into a single instance that aims to have this comprehensive view of the patient transitions throughout the healthcare system. And this is currently done, as I mentioned, throughout interoperability, basically because in our service provider organizations we have many different systems. We also have a unique prescription system for all the ambulatory medications, completely linked to the community pharmacies, and that was possibly one of our biggest projects and the first one. And within the years, we have been moving towards what we call federated platforms. The idea of federated platforms is to take advantage of economies of scale, and instead of having each of our service provider organizations an infrastructure, for example, to store digital images, just to have a central imaging archive at the government level, and then our service provider organizations just having a small instance in the hospital, and thanks to the good communications that we have now, taking advantage of these economies of scale. We are doing this in digital imaging, we are doing this in digital pathology, we are also doing this, and this is a new project, on genomics. So basically, central instance and then some federation built around the central instance. We also have a patient portal very long-standing patient portal also since year 2000 and 2009, which is accessible by all of our citizens. The truth is that we weren't very successful with it until the pandemic came, and we took advantage of the pandemic to ramp up the usage of the patient portal. Right now we have almost 6 million citizens registered out from the 8 million Catalonian citizens. So this is almost everyone has access to the portal, because the ones who don't, it's children who are too young or elderly people who do not access it. The patient portal, as I mentioned, we took advantage of the pandemic. When the pandemic started in March 2020, we had 300,000 registered users in the portal. So after 11 years of having the patient portal, we weren't successful in engaging with our citizens to use this. But within the pandemic, we started to move services in there. So the renovation of the prescriptions, the digital certificates, many different things which came in very handy at that time, also remote consultations, which brought patients to start using it. And now we have, I would say, a great usage of the tool, which is sustained over time. Another big change was the remote consultations, in which we moved from 2,000 per week to 40,000 per week now. And this is also sustained now over time after the pandemic, which is, I think, a good thing for us. And now, lately, we've been thinking on what's next for us. And we started a reflection process back in year 2017, saying, okay, we are quite happy about the deployment of health information technologies that we have here within the public sector, but what's next for us? And here it's when I want to go back a bit on what I mentioned at the beginning. I told you we consider this first deployment of EMRs the first generation of EMRs, which is standalone solutions at the level of the service provider organization, in which the care processes stay within the organization. For us, the second generation EHR, this time, not EMR, so trying to have this longitudinal view, was the shared electronic health record of Catalonia. And here, throughout interoperability, we have been able to build more or less this comprehensive longitudinal view of our patients. But this is very patchy. We acknowledge that this is very patchy. And this is very patchy because the level of conversation that our different systems are able to have, it's very different because they are not built using the same standards. And we are using interoperability standards for them to communicate. But once you want to build these longitudinal care pathways that overcome the barriers of service provider organizations and healthcare levels, you need something else. So here we want to stop talking about transitions and I would say the patchy journeys or patient journeys that we have. And we want to start talking about multidisciplinary teams of professionals that are able to act on the same individual seamlessly, without really the patient experiencing a patchy journey and without the patients being lost in transitions. And that's, for us, the future. And the future, it's what we call the open platform paradigm. The open platform paradigm, it's nothing that we came up with. No, it's not just a Catalonian idea. In fact, this is an adaptation from a proposed architecture built by the Aperta Foundation in the UK, which we think this is the future of the healthcare system. And with this is where we are able to build this third generation EHR that I was mentioning before. Sorry. So the third generation EHR, it's built on this idea of the open platform. And this means that we will have a platform which runs on open standards. And with open standards, I mean that they will be public and accessible to everyone. The second thing is that we from the government will foster and will control this platform in a way that we will grant access to all of our ecosystem for them to be able to develop on top of the open platform. And this is quite of a change. If you think about the monolithic systems, about the big EMR, EHR vendors, you get locked in their solutions, and somehow you are killing the innovation in the ecosystem. We want to open this up. And we want to open this up. If you think about, for example, the Android marketplace or the iOS marketplace, it was Apple and Google. They have their mobile phones, which can be a platform, and they have open specifications for everyone to develop on top of their solutions. Well, our objective is more or less doing the same. By using open standards and by using open APIs and by having a very robust governance on the information models in which the platform is sustained, we will allow all of our ecosystem to develop solutions in there. And proceeding in such a way, we truly think that in this way, innovations will scale up across our ecosystem, because now we have a lot of difficulties of these innovations scaling up, because most of the time they stay, I would say, in the local experience, and they are not able to scale to the overall Catalonian ecosystem. And in this way also to generate business opportunities also for Catalonian companies, because I truly think that we from the public sector should be fostering this and not locking us into a big American EMR vendor. So that's more or less the idea of the open platform. The open platform will be built, I mean, there's just one set of standards or set of specifications that allow to represent clinical knowledge within the technical landscape. And this is OpenAir, OpenEHR, what you have there in the right-hand side of the slide. And Catalonia has committed to go towards OpenAir, and you will be listening more and more about that, because that's truly the only way to build this third generation EHR that I was mentioning before. Then, and this is my last slide. A strategic plan or a strategy, it's a very nice document, a very nice PowerPoint, a very nice presentation, but if it doesn't come associated with financing, it's worth nothing. I truly believe that we from the public sector have a lot of room to do innovation, despite many think that this can only be done from the private sector. We can do the riskiest investments, and that's basically what we are doing in here. And I think that we are lucky enough that we've been able to convince our government officials to support these ideas that we have. So here you have some funding. The first phase of the digital health strategy for Catalonia was funded with 40 million euros. Now for the second phase, we are requesting 150 million euros to be able to build mainly two things. One is the open platform and all the services surrounding the open platform, which means that we will support all the startups, all the software developers that want to develop solutions on top of the platform. We will have a pathway to support them and connect their solutions to the platform. That's one thing that we will do with this funding. The second thing that we will do with this funding is to develop our own EHR and the main functionalities of our EHR. So we are not going towards a vendor product, we are developing our own EHR. And in this process, we are looking for partners. And I think that this is a very good place to come and look for partners. And I say partners because I don't want to talk about providers anymore. You know, we from the public sector have this relationship mostly with our providers, which is client-provider. We would like to change this and be truly able to find partners in this journey. It's not an easy one. And we would love to have you on board in this project. And in order to do this, we will also facilitate this collaboration by giving incentives that we haven't given in the past. And one idea is we would be sharing the IP of the solutions that we would work with you. So Imagine that we will develop the AHR with a consortium of partners. Well, we are happy from the public sector to share the exploitation and the property rights of the solution for you to be able to sell it outside of Catalonia. We want to stay in the governance of the solution, but we are happy that you also can take some benefit to the outside world. And then, in this way, advance towards this partnership and hopefully advance towards a better future. Here, there's a list of many other funds. There's plenty coming in the coming months, and I invite you to look carefully into the public procurement portals, because all these things will keep coming within the next months and years. And thank you so much for your attention.